Well, good afternoon, everyone. It's such a pleasure to be here in Lycoming County and here in Williamsport to have this opportunity to present the Rural Health Legislator of the Year Award to Senator Yaw. As Barry said, my name is Lisa Davis, and I'm the Director of the Pennsylvania Office of Rural Health. My office is one of 50 state offices of rural health in the country, funded by the U.S. Department of Health and Human Services to be a source of coordination, technical assistance, and networking between and among anyone in the state and nationally who is focused on increasing access to healthcare services in rural communities and increasing the health status of rural Pennsylvania. My office is funded by the Federal Office of Rural Health Policy in the U.S. Department of Health and Human Services, by the Pennsylvania Department of Health, and we're located at Penn State, just right down the road here. So if you don't mind, so that I'm sure not to miss anything that I'd like to be able to say, I'm going to pull out some notes that I've made. So it is my pleasure today to present the 2015 Rural Health Legislator of the Year Award to Senator Gene Yaw. This award recognizes an outstanding Pennsylvania legislator for their work and support of rural health initiatives that address an identified need in their district or across the state. Senator Yaw was elected to represent the 23rd Senatorial District in November of 2008 and represents all of Bradford, Lycoming, Sullivan, and Union counties and parts of Susquehanna County. Senator Yaw serves as chairman of both the Center for Rural Pennsylvania and Senate Environmental Resources and Energy Committee. He is also a member of other Senate committees, including Agriculture and Rural Affairs, Judiciary, and Majority Policy. Senator Yaw is being recognized for the substantial contributions that he has made to rural health in Pennsylvania in his role as the chairman of the Center for Rural Pennsylvania. As chairman, he organized and hosted a series of public hearings in July and August of 2014 on the heroin epidemic facing Pennsylvania. The increased use of heroin, which often has roots in the abuse of prescription painkillers like Vicodin and OxyContin, has catapulted Pennsylvania to 7th in the nation for drug-related overdose deaths, according to the latest statistics from the U.S. Centers for Disease Control and Prevention. The heroin crisis is affecting urban as well as rural communities. According to the Pennsylvania Department of Health, from 2007 to 2011, 17 counties in Pennsylvania had overdose deaths above the statewide average, and 12 of those counties are considered to be rural, according to the Center for Rural Pennsylvania. From the hearings, community leaders, local law enforcement and judicial systems representatives, hospital and healthcare system administrators and providers, treatment providers, academics, nationally recognized experts, recovering addicts, and family members who have lost loved ones to drug overdose deaths, almost 100 persons providing over 30 hours of testimony were engaged in this effort to look at the issues of education and prevention, treatment and recovery, and law enforcement. And on a personal note, I was able to participate in one of those hearings at St. Francis University, and it was an overwhelming event and really, I think, underscored the important role that the senator has played in addressing this issue in Pennsylvania. The public hearings chaired by Senator Yaw and the report that was released at a September 2014 Harrisburg press conference entitled Heroin, Combating This Growing Epidemic in Pennsylvania have been credited with generating greater awareness and support for then pending legislation, Senate Bill 1180, Prescription Drug Monitoring, and Senate Bill 1164, naloxone and immunity from prosecution. The state legislature passed Senate Bill 1164, known as Act 139, on September 30th of 2014, and Senate Bill 1180, known as Act 191, on October 27th of that same year. Those bills were signed into law by then Governor Tom Corbett. Both pieces of legislation were deemed critical to addressing the public health epidemic of heroin and opioid abuse that has claimed the lives of more than 3,000 Pennsylvanians in the last 5 years alone. Senator Yaw has held the position of chairman of the Center for Rural Pennsylvania for over 5 years. He has consistently shown his leadership in ensuring that the center's research and data analysis is relevant and timely, not only to state government, but to organizations and residents throughout rural Pennsylvania. Under his chairmanship, the center has undertaken research investigating the impacts of Marcellus shale gas exploration in rural Pennsylvania, which was a 6-year longitudinal study, a 5-year project interviewing waves of rural school students on their educational, career, and residential aspirations, and the updating of Pennsylvania's Transfer of Wealth report that assesses the wealth in all 67 counties in Pennsylvania, projecting timeframes for when that wealth will be transferred to the next generation, and strategies for community and private foundations to garner some of that wealth for community-based projects. So it is my honor to ask Senator Yaw to join me. And I'm pleased to present you with the 2015 Rural Health Legislator of the Year Award.
Thank you. When I first heard about this, I made the comment that I was speechless, really, because it was something I never anticipated, never strived for, or we just did things without thinking about what the outcome was going to be, or without any plan, other than the fact that the intent of the series of hearings that I had was to raise the awareness of the drug problem in rural Pennsylvania. And the way it came about, I guess I'm not sure I can even take credit for it, but there was another legislator approached me on the floor of the Senate and said, as the chairman of the Center for Rural Pennsylvania, can't you use the center as a vehicle to raise the awareness of the heroin problem in rural Pennsylvania? The original thought was that we would have maybe a hearing in in Harrisburg, and the more we thought about it, we thought, well, no, we don't want to have it in Harrisburg. We'd spread it out throughout the state. So I don't even remember where we were. The first one we had was here in Williamsport. It was originally scheduled to last 3 hours. It lasted 5. And then I forget. Then we went to Reading, I think, and then we went to St. Francis, and where else? We went to Clarion last year. Now, that was last year. And then there was a report done, which I thank my staff and the Center for Rural Pennsylvania staff for the report. It's probably the most definitive report that's been done by the state or by any state agency on heroin or any drug problem in Pennsylvania. And the Center for Rural Pennsylvania, for those of you who don't know, is a joint legislative agency. It's bicameral and bipartisan, and it also then has several academics on it, on the board. And I want to thank the Center for Rural Pennsylvania, because had the board not approved what we did, we would have never been able to go ahead and do it. But the board thought that it was an important enough issue that we should go ahead and try and raise the awareness. Not to be outdone by last summer, since I spent the summer last year doing hearings, we did it again this summer. We only had 3 hearings, though. Remind me, St. Vincent, Latrobe, yeah, St. Vincent's right before the Steelers came there. Scranton at the Commonwealth Medical College, and in York. This year we tried to focus more on treatment and what the issues are involving treatment. And I'll tell you, anybody wants to get a really good education on what the drug problems are in Pennsylvania or in the United States, as was stated, there's about 30 hours worth of presentations on my website and on the Center for Rural Pennsylvania website. And it is, if you want a quick dose of what is going on in the drug world or what our problems are, there's an easy way to do it. Like a lot of times I find people, they say, oh, well, we want to have some meeting and we're going to have a task force and all that. Been there, done that. And if you want to save a lot of time, just go to one of the websites I mentioned, and everything is there. To say it's not a problem in Pennsylvania, there are 7 people die per day of drug overdoses in Pennsylvania. That's pretty significant. You know, multiply it by 365, that's 2,400 people are going to die this year. There's 7 people today going to die of drug overdoses. That's something. And we also found out that about 80% of addicts start by the abuse of prescription drugs. There's some significant correlation in problem areas here. We also found out throughout this that it is not something that we can't, police officers or in the courts, everybody will say we cannot arrest our way out of the problem. We can't put, those are tools to use, but that's not the solution. It takes a community-wide effort. And the best example I use all the time is if somebody has diabetes, you don't send them away for 30 days and they come back and they're fixed. Addiction is a lifelong problem, and it takes a lifelong commitment to address the issue. We here in, I think, Lycoming County is fortunate. We're way ahead of the curve. We started, with the help of Beth McMahon and Judge Butts, we started Project Bald Eagle, which I can't help but note that there was a big article in the Sun Gazette a week ago, or I don't know, or I guess over the weekend, about a program in Rutland, Vermont. It was called Project Vision, and it sounded very similar to what we're already doing. But we've tried to put together a community-wide effort to address it. And the one thing that came out of the hearings is we have a lot of drug programs in Pennsylvania. We spend a lot of money on them, but the system is very, very fragmented. It's not put together. And to be very honest about it, everybody wants to protect their own little fiefdom. They don't want to share things, and I understand it's a basic nature that they want to build up their own area and not necessarily keep the focus on what we are really trying to do. So that's what we found out. It's been a real trip. Some of the legislation that we managed to pass last year has already been mentioned. Some of the things that came out, and I've already started to talk about this, and we started to work on this. One of the things that we've talked to the medical people about is making certain training involving pain management and medication mandatory in medical schools in Pennsylvania. And so far, we've gotten a really good reception as far as doctors and the medical society. So that's something we're going to work on and introduce some legislation along those lines, because right now, doctors get less training on pain management than veterinarians do. So that's one of the issues that we're facing and we hope to address. The staff right now, as I said, is working on the follow-up report. I'm not sure how soon we're going to get that done. When is that going to be done, Barry?
Mid-November is my understanding.
Okay.
For the release.
Yeah, I originally said, gee, before Christmas, and then everybody thought that was too far away. Barry Denk is the director of the Center for Rural Pennsylvania, and he does a great job in helping and putting together. And the Center for Rural Pennsylvania is a great staff. If any of you ever need any information about any statistical thing or some I don't know, inane subject of that's reduced to numbers. We have a person on staff who can produce charts and more information about numbers than anybody I've ever seen. But it's been a real pleasure, and from my perspective, to be able to do what we originally set out to do, and that is to raise the awareness of the drug problem in rural Pennsylvania. We've now, I think, managed to get the attention of a lot more people than just rural Pennsylvania. And, you know, that was our primary goal to start with. We've branched out and want to do some other things now, hopefully use it as a basis for legislation. But I want to thank you. It's been a pleasure. And this was totally a total surprise to me. So thank you. We have nothing else?
I'm not sure what we do from now on, but I think, I again want to thank all of you for coming today, and certainly want to say what an honor and a privilege it has been to be able to present this award to the Senator. And I also would like to add my thanks to the Center for Rural Pennsylvania. I call them so often that I think they have a whole drawer full of my requests that I've made, and I don't even have to announce who I am anymore. I like to say that they are essentially the best organization in the state. They have a phenomenal source of resource, a phenomenal breadth and depth of information, and I refer just about everybody to them. So if there, as the Senator said, if there is anything that you might need, any data, statistics, reports, the Center for Rural Pennsylvania is certainly the place to go. So thank you all so very much for coming on this afternoon, and thank you again, Senator, for having us here.
Thank you.